Problem that's plaguing ERs and urgent care centers across the country are patients showing up with problems that cannot be easily addressed by the physicians or the healthcare providers working at those clinics or centers. The reason is those centers are equipped to triage patients suffering from acute conditions, meaning very rapidly evolving conditions, and then direct them to the next care provider, either at an inpatient facility or in an outpatient facility. Going to the ER, to the urgent care clinic, is something that is time consuming, obviously has you wait for hours until you're seen in some cases, and is very costly. The copays or out-of-pocket expenses for these visits are very, very high compared with outpatient services. So it's important to distinguish what kind of skin conditions would have you go to the ER in case you cannot see a dermatologist that day, or you have developed your symptoms after business hours, or you can actually wait till the next day or the next few days to address your concerns. So it's very important, and that can mean long hours of waiting at the ER saved. That can mean big bucks saved. And what a lot of people don't consider, that can actually shorten your diagnostic process and treatment process, because going from one doctor to the next does actually complicate things. And you may be given a few opinions that are conflicting if you go from doctor to doctor to doctor, from provider to provider to provider. So let's try and break this down. So first of all, let's look at skin problems that I would recommend seeking medical attentions for within hours of appearance. One category of conditions that is very important to treat early are bacterial skin infections and some forms of viral skin infections, specifically cellulitis and abscesses or boils on the skin. Those can develop into a life-threatening condition if untreated early, and that's something that does need to be evaluated very quickly from the time it appears, may be cultured to find out what bacteria is causing your skin condition, if that's the case, and treated with antibiotics, or sometimes in the case of boils or abscesses, drained surgically, which can actually be done in the ER and also can be done in the dermatology clinic. Now, what's interesting is that a lot of people going to the emergency department or going to urgent care expect to see a dermatologist. That is usually not the case. In urgent care, there are no dermatologists on call, and what you're seeing are the general practitioners that are staffing the clinic. In the emergency department, especially in bigger university centers, you may see a dermatologist trainee in case the condition appears serious enough for the emergency department staff to summon that trainee to see you. But what will ultimately happen in most cases is that that trainee will take some notes, evaluate you, may make some suggestions to the emergency department staff as for how to approach the problem if that's within their purview. But ultimately, you will be scheduled to see the specialist, that is the fully trained, fully fledged dermatologist at the outpatient setting, so they can actually take a look at you, evaluate your condition from their end, if it actually lasts that long, and treat it from their perspective. So you're not going to be seeing any dermatologists or any fully trained dermatologists in the emergency setting, and that's something very important to realize. So if you do have a skin infection, emergency department staff and urgent care staff can definitely treat that. And in many cases, they can actually drain those infections in case there's a drainage that needs to happen. In case you have an infection with herpes simplex virus, or you have a case of shingles, otherwise known as herpes zoster, those cases can be treated as well by emergency department staff and by urgent care staff. If the suspicion is there and have made the right call, they can actually start you on treatment that would likely shorten the duration of that infection. Another thing to consider going to the emergency department for is a very rapidly evolving, widespread eruption on your skin. An eruption is a collection of similar looking lesions on the skin. Many eruptions that we see in clinic or in the emergency department are usually red areas, scaly areas, and other similar looking lesions, and they usually cover large areas of the body. Now, eruptions or rashes can appear over limited areas of the body, or they can cover very large areas of the body. The concern with very large areas of the body covered by a skin condition, especially when it evolves rapidly, is that there could be a breakdown of the skin over a very massive scale, and that could lead to serious complications. And other skin conditions that could be very widespread and evolve rapidly are hives. And in very severe cases of hives, you may experience symptoms that involve other organ systems, such as the respiratory systems. So very severe cases of hives can sometimes be associated with anaphylaxis, which is a form of cardiovascular symptom that causes decreased blood pressure and possibly even more serious issues, and can sometimes lead to trouble breathing or a constriction of the airways. Those are extremely rare, but if that's your suspicion that you're actually suffering from something like that, then you'd be in the right to go seek urgent care at the urgent care clinic or the emergency department. That being said, if your skin condition is very limited and there's no significant pain over the area, there's no major redness, there's no discharge, there are no fevers or chills, then you're likely suffering from something that's a little bit milder, and that can wait till the next day to see the dermatologist in the outpatient setting. You'd get much more speedy care. The diagnosis is going to be made much more simply, and you will be getting your treatment much faster, albeit you'll have to wait till the next day to see the dermatologist. So consider that. This is not a recommendation to do either or, but just to give you a lay of the land as for what would be considered urgent and would likely require urgent medical care, and what would likely get less benefit by your waiting all those long hours in the emergency department and waiting to see a doctor in the emergency department to be later scheduled for a dermatology visit. Another condition to be paying very close attention for is bruising of the skin. If you're experiencing bruising of the skin on the tips of your fingers on your toes, or you're experiencing very widespread bruising that's evolving very rapidly, that could be a sign of either some form of a blood clotting disorder or what we call a thromboembolic disorder, meaning there are blood clots inside the bloodstream that are being transferred through the bloodstream to the extremities, to the tips of the finger, and that could be a sign of big trouble. So if you're experiencing something like that, by all means, go to the emergency department as quickly as you can and seek medical attention. If you're getting bruises on your arms every now and again, that is not a sign to go to the emergency department. But again, pay attention carefully to the extent of your skin condition and to the speed in which it evolves, which could make a world of difference from where it is that you need to be treated. Something to pay attention to, by the way, if you're having some form of a blood clot event, it's important to pay attention to other signs and symptoms that are associated with blood clots, such as chest pain. Sometimes there could be some neurological issues. If you're paralyzed, God forbid, over one half of the body, or you're paralyzed, or there's a weird sensation over one part of the body that you're not used to, that could be another sign of very serious issues, and that would be something that I would go to the emergency department for. If you're getting severe lymphadenopathy, meaning swelling of the lymph glands or nodes, which is diffuse, that could be another sign of infection, and that would be another reason for you to go seek urgent medical care, and that would probably be a reason to go to the emergency department as well. So these are some signs and symptoms that would require you to go to the emergency department and seek medical attention for skin problems. Obviously, there's more to it than that I do recommend that if you're not sure, go to the emergency department. But obviously consider how rapidly evolving your condition is, how widespread it is, and what are the associated symptoms that come along with what it is that you're seeing on the skin. If this becomes something that is highly concerning to you, by all means, go to the emergency department and do not hesitate. Then again, let's take a look at reasons for you not to go to the emergency department and actually wait that extra day to see the dermatologist. So an obvious one would be a changing mole. Now, a lot of people consider changing moles to be an emergency, and I don't blame them. It very well be an emergency in the sense that it needs to be diagnosed quickly and determine what is the right course of action, especially in cases of skin cancer. That being said, the emergency department or urgent care are not the right place to make the diagnosis of skin cancer. They usually do not have the capabilities or the expertise to do a skin biopsy. That would be in the purview of dermatology. And the processing of those specimens, in case they can't actually send a specimen out from a biopsy, that would be much more complicated for you to get the results back. And that would just prolong your care management and diagnosis. So your best bet, if you're seeing a changing mole on your skin or any other skin lesion that you think might be a skin cancer or something similar, wait to see the dermatologist, to have the dermatologist evaluate in the outpatient setting. Take the right amount of time to decide what to do, and if appropriate, get the skin biopsy, send it out, and get you the bottom line that you need. Another obvious reason not to go to urgent care or to the emergency department, and believe it or not, there are people who actually go there for that reason, is for prescription refill. If you have any prescription that needs to be refilled, especially of medications that you take consistently, unless it's an emergency, there's some form of an infection that you treat with those medications, something that is completely and utterly disastrous if you don't get the medication immediately, I'd say do not go to urgent care or to the emergency department to refill your prescription. Put a call into the dermatologist's office or come see the dermatologist in case there's been a long time elapsed since your last visit for having been evaluated for that condition that'll require that prescription. Another condition that can make some people very, very apprehensive is hair loss. So hair loss is a very broad category of conditions. We've talked about many of them in previous videos. Hair loss can be a very scary thing, very scary prospect for a lot of people, especially if it happens very quickly. That being said, the emergency department is not the right place to diagnose, treat, and manage hair loss. So if you're suffering from hair loss, even if it's a very rapid onset hair loss, and you can't just make that appointment immediately, wait to see the dermatologist to diagnose the condition you're suffering from and set up a treatment plan to follow up with to make sure that your condition is being managed appropriately and is meeting the right expectations in the time frame that you'll set with your dermatologist. Interestingly enough, I remember as a young intern in Israel, we had a patient who showed up to the emergency department at 2 a.m. in the morning with a nail problem. That person in particular had nail fungus. When we asked that patient why he decided to show up to the emergency department at 2 a.m. for nail fungus that he admittedly had for about 10 years, he just shrugged his shoulders and said, "Well, I've had enough." That's not a good enough reason to go to the emergency department, let alone wait all those hours in the waiting area and then be seen by a doctor whose specialty is not to treat nail fungus. If you have a chronic nail condition, wait to see the dermatologist at the outpatient setting. This is very important. Emergency department doctors and staff or urgent care staff are not the right people to see you for nail problems, especially the chronic nail problems. And I want to emphasize, if you're suffering from acute paronychia, which is not a nail problem but a peri-nail problem, meaning severe inflammation or possibly even infection of the skin surrounding the nail and the cuticle, that's a reason for you to go to the emergency department. If you're suffering from nail fungus or some other chronic nail condition that's been hanging around for a long time, the emergency department is certainly not the right setting for you to be evaluated and be treated. So be patient and go to see the dermatologist at the outpatient setting. And last but not least, and this is another condition that can be very, very scary for someone who thinks they have this, that is warts, specifically genital warts. So genital warts can show up, and they can show up pretty quickly actually. You have to bear in mind, genital warts are not a condition to be treated in the emergency department. So that is a condition that is usually treated in the outpatient setting. In most cases, it can be treated by locally applying liquid nitrogen or other forms of treatment depending on your discussion with the doctor and on the circumstances that are pertinent to your case. That being said, warts are not a matter of emergency, so you'll be again wasting your time and money waiting in the waiting area to be seen by the doctor, who then will not be able, most likely, to treat your condition appropriately, much less so follow up with you on the results of the treatment, because this is the emergency department. This is a one-time deal. You go there to treat something urgent, and if they cannot treat your condition, they will refer you to the next specialist, either inpatient or outpatient. So the most you'll get out of seeing an ER doctor for warts will likely be a referral to the dermatologist. This is not a good use of your time and money. So be wise about using both. If you've enjoyed this video, share, like, and subscribe. Put a comment in the comment section and tell me what are some things that you've heard people go to the emergency department that turned out to be not so urgent and could have been evaluated by a specialist in the outpatient setting. More great content coming your way right from this channel. Thanks for watching, and God bless.